Judith Sandalo.
Yes, good afternoon, Chairman Berry. As you said, my name is Judith Sandalo. I'm the Executive Director of the Children's Law Center and a resident of the District of Columbia. Children's Law Center is the largest nonprofit legal services organization in D.C. and the only one devoted to a full spectrum of children's legal services. We represent over 1,200 children and families in the district, low-income families in the district every year, and I am testifying strongly in support of this legislation. I want to focus on the effect the legislation will have on children's health. One of our major initiatives is our Health Access Project, which, as you heard from Dr. Ballard, is a medical-legal collaboration between the Children's Law Center and Children's National Medical Center. We have lawyers on site as part of the medical team on Good Hope Road, Martin Luther King Avenue, in Adams Morgan, and at the main hospital, and we also serve the ARC and other clinics. We've had lawyers on site since 2002, and we frequently represent clients dealing with unsafe housing conditions which are causing or exacerbating their children's health conditions. The doctors we work with are often frustrated because despite the best medical care they can provide, if the housing conditions are not improved, children simply do not get better, and in some cases their illnesses get worse. My testimony is replete with statistics, and I'm not going to spend your time reading them aloud, but I hope you will have a chance to look at them because the number of children, the literally thousands of children in the district whose health is made worse by poor housing conditions is carefully documented. And I don't want you to walk away thinking that we are talking about mild health problems. We are not talking about exacerbating allergies and sniffles. We're talking about children who literally, because there is mold covering their walls and causing holes and feces that have overflown the toilet and are all over the floors, literally going to the emergency room 2 to 3 nights a week, who are so tired from their asthma that they can't go to school and begin the decline even in elementary school to the point where you will see them later on as teenagers dropped out of school because they couldn't keep up. We are talking about truly devastating problems. We have a child who's 12 years old with Down syndrome. He and his sister are terrified of getting out of bed at night because there are rats who run the floor and they're scared to get out of bed to go to the bathroom at night or to seek their parents' help if they're sick. The horror of the problems that the children suffer and the extreme cost both to them, their families, and to taxpayers of the district is carefully and thoroughly documented. The legislation that is before you will be a big step in solving that problem. If we can go to court on behalf of these families, if they can go to court on their own and seek a solution quickly, we have watched children go from failing out of 3rd grade to getting straight A's because we got their asthma under control, because we got the rodents out of their home, and now they are on a path to success in society rather than to becoming a drain and harming their own health. I urge you to I'm going to make my time. I urge you to move this bill out of committee and to quickly get it enacted. Thank you.
Thank you very much for your testimony. The Children's Law Center.
Yes.
What is that? I know this is just for the public.
And I like that you're asking. We're the largest legal services organization in D.C. We have 70 full-time staff. We serve 1,200 kids a year. We represent children in the foster care system. We represent grandparents, relatives, and foster parents trying to help kids get out of the system or prevent them from going into the system, helping them with adoptions, guardianship, and custody. And we also have a very big project, which is our partnership with Children's National Medical Center. And through that project, we actually are part of the doctor's team. Dr. Ballard can literally call one of our lawyers into the examining room to meet a child and his mother to talk about a health problem and figure out what the legal solutions are.
Matthew, have you all had any experience with maybe for an entire building filing a class action suit to get at some of this?
We do have some experience with that. There are so many class action lawsuits in the city, and we believe that they're important. Rather than filing new suits, we've tried to work more collaboratively with the executive to try and propose solutions to give legislation. We have legislation that we've been urging to be passed out of a different committee to try and affect solutions through other mechanisms.
What has been your experience? Has that worked? Have you gotten any successes with that approach?
We have.
What have we gotten done?
Right now, there's a bill pending, which I hope you will have an opportunity to vote on soon, to expand the adoption and guardianship subsidies for families who have adopted children between the ages of 18 and 21 years old. It is right now one of the biggest barriers to getting kids out of foster care that we have, and Mr. Brown introduced the testimony, co-sponsored by quite a number of people. I believe you as well co-sponsored it. And that was a collaborative effort working with members of the council.
On an unrelated matter to this bill, but related to foster care, right now the emancipation age is 18, is that correct? And a person can elect to continue up to age 21.
In foster care?
In foster
yes.
care, yeah. Would you be in favor of extending that age to 21?
Right now, children are under the jurisdiction of the court in foster care until they're 21, and the only way that can get changed is if a judge believes it's in the child's best interest to determine.
Legislatively, couldn't we change it legislatively?
We don't need to change the legislation on that. It actually does the right thing. What we're hoping to do is help children.
What about subsidies and payments and support systems for kids over 18? Do they still get it?
The children who are committed to CFSA as wards of the district are, the government is required to provide them with housing and food and supports to grow to adulthood. There is always a need for improved and expanded programs.
Well, what do you suggest we do?
There are a couple of very successful programs. One of them is the Rapid Housing Program, which is a program that helps children transition to adulthood with enough housing to make it so that they aren't homeless. That program is never fully funded, so expanding funding in that program would be very helpful. I'd be happy to work with your staff on more ideas if you're interested, because I think it's very important.
I've had awful experiences with that.
Yes.
With CSFA. I have a godson that was in foster care from age 14, and he still is. But because I put on all the resources I know how to pull up on, he was in 6 foster care homes, places, batted around here, there, everywhere. And we finally got him into Jimmy Jones's independent living program, which helped tremendously. And he's now a freshman at Langston University in Oklahoma. But what about those parents that don't have that kind of resources, don't have that kind of stick-to-itiveness, caseworkers that don't have the same kind of stick-to-itiveness? I'm trying to figure out a way where these young people are not sort of dropped after 18. Well, they're not dropped, but what's the point of saying emancipated if it doesn't have any effect on you, does it?
Mr. Baird, you are identifying one of the biggest problems we have, which is not supporting our children and the families who are taking care of them, whether they are relatives or birth families or foster families, so that children can stay where they are. There's no reason your godson should have been in 6 different foster homes. He should have been provided with an adult, whether it was a family member or a foster parent who's not a family member, who had the services and supports to help him mature in one place. He should not have been moved from place to place.